we started registering all our community health workers in the country, because we want to know who are they, where are they. We want to know who are those that are trained, which capacity, who are those that are equipped. But at the end of the day, we want to make sure that we coordinate them better by attaching all the community health workers, whether VHTs, CHUs, linkage facilitators, mentor mothers, the APS, whoever calls themselves a community health worker should be tagged or attached to a facility for supervision, for coordination, for supply chain. We are trying to see how do we improve the community supply chain system. Those are the resources that come from through the facility, and those are the resources, medicines and supplies that support provision of services, especially community services. We are looking at financing. How do we increase financing? Okay. How do we make use of the U-Gift fund? How do we make use of the local revenue? How do we reorganize and optimize the already existing finances that are being brought in by stakeholders and partners and already at the district, to make sure that we give the best to the people, we provide the best services that we can provide. Then we are looking at our coordination. How do we make sure that we implement one community health work plan, one community budget, one community output? We are guided by a standardized package. How do we make sure that we all speak the same language? Because we are all providing services to the same people, the same population, and we must hold ourselves accountable. And then now we also had discussions about community engagement, and this is what really excites, because community engagement is like placing people at the center of their health. So how do we empower them to engage? How do we create forums and structures that will help them to engage, participate, speak out? For example, under the PDM, where we are talking about now creating systems where even villages are going to be making their own village action plans. And these village action plans will be plans based on the needs and the gaps that villages, that parishes have seen, that those are needs that were most pressing to them. And so as we move forward, we're excited that it's a new journey. It's not easy per se, but we need to move as a country. We need to take back the government, the health, back to the people. Because we've just discovered that the Ministry of Health reports that 75% of diseases, or more than 70% of the diseases that are treated in facilities are actually preventable. And because these diseases are preventable, that means if we build up strong community systems, if you make communities appreciate that it's their roles and responsibilities to maintain health, to keep health, to create health, then those diseases will drop. And then the burden of people who go to health facilities, when actually they would have prevented these diseases from home, will reduce the number of people. And not only you and me will benefit, but facilities will be left to concentrate on people who really need to be in the facilities. Those who don't need to be in the facilities will see that they minimize things that expose them to diseases or conditions that have to take them to facilities, to overwhelm facilities. Because these facilities were created to manage a few number of people, not everyone, considering that majority of the interventions are preventable through nutrition, through actions that prevent disease spreading of vectors, breeding, and name them like malaria, clearing of bushes, eating well, okay, sleeping under mosquito net, immunization and vaccination. These are things that we need to do. So we as the community health department, we're excited. We commit to serve, and we commit to do our best to serve the people of Uganda. We commit that we shall do our best as the department to play our role. As long as also the people of Uganda know that they have a big role to play, because health is with them. It's them that get sick. Under PDM, we say that health is wealth. So we cannot you cannot make money if you're sick. It's possible that you save 100,000, and then when you get sick, you use the 80,000 or even 100,000 or more of what you've spent. That means you're working in losses, basically. You're working and spending it on health. But if you're healthy, that means you'll be working and saving. So either way, it's a win-win for all of us. So I rally everyone, let's move together, let's move as a team, let's move as a lot, let's have a better Uganda, let's have better homes and clean homes and healthy homes, let's eat well, let's really go seek for services well, let's be our neighbors, let's watch our backs as neighbors. If there's any disease that has broken out in your village and it's like a pattern, you see it's a pattern of conditions, please inform your VHT, inform the LC1. There's a VHT on the LC1 committee. If animals are dying, if animals are getting sick of a certain pattern of disease, please report it before it spreads, before we lose lives.